Question 1. Veterinary pharmacology and toxicology. A veterinary technician is preparing to administer an anesthetic to a feline patient undergoing a minor surgical procedure. The drug chosen is propofol, a commonly used induction agent. However, the technician is aware that improper administration of this drug can lead to severe complications. What is the most appropriate way to administer propofol in this situation? A. Administer as a rapid bolus to achieve immediate induction. B. Administer as Roman over 6090 seconds while monitoring the patient closely. C. Administer intramuscularly to avoid the risk of Roma injection. D. Administer with an opioid premedication to avoid the need for careful titration. Answer. B. Administers at Roman over 6090 seconds while monitoring the patient closely. Explanation. Propofol is an ultra-short-acting, non-barbiturate anesthetic used for induction in veterinary medicine. It should always be administered as a Romano injection over 6090 seconds to avoid severe cardiovascular and respiratory depression. Rapid administration, option A, can cause apnea, hypertension, while intramuscular administration, option C, is not appropriate as propofol is not absorbed effectively via this route. Option D is incorrect because, while opioids are often used in premedication, they do not eliminate the need for careful Roman titration of propofol. According to the American College of Veterinary Anesthesia and Analgesia, propofol should always be titrated to effect under close monitoring. Question 2. Surgical nursing and operating room procedures scenario-based. Dr. Thompson, a veterinarian, is performing an emergency exploratory laparotomy on a Labrador retriever suspected of having a gastric foreign body obstruction. The veterinary technician, Lisa, is assisting in the surgical suite. During the procedure, the patient's blood pressure drops significantly and the capillary refill time increases to over 3 seconds. What Lisa do first to assist in stabilizing the patient? A. Increase a Roman UID rate and notify the veterinarian immediately. B. Administer epinephrine to restore blood pressure. C. Stop anesthesia immediately and allow the patient to wake up. D. Continue monitoring and document the changes, but wait for the veterinarian's instructions. Answer A. Increase a Roman UID rate and notify the veterinarian immediately. Explanation. A significant drop in blood pressure, hypotension during anesthesias. A critical emergency. The correct immediate response is to increase AM and UID rate to restore intravascular volume and improve perfusion. Option B, epinephrine, is incorrect because epinephrine is used in cardiac arrest situations, not for routine hypotension. Option C, stopping anesthesia suddenly could cause additional complications, including patient movement during surgery. Option D, waiting for instructions without action, is inappropriate as immediate intervention is necessary. According to the American College of Veterinary Surgeons Acts and AHA anesthesia guidelines, intraoperative hypotension should be managed by fluid resuscitation, reducing anesthetic depth, and using vasoactive agents if needed. Question 3. Veterinary ethics and legal considerations. A veterinary technician notices that another technician at their practice is routinely refilling prescriptions for controlled substances without veterinarian authorization. The technician is unsure of what to do, but they are aware that dispensing controlled substances without proper oversight is a serious violation of veterinary regulations. What is the best course of action in this scenario? A. Ignore the situation, and as it is the veterinarian's responsibility to oversee prescription management. B. Report the issue to the supervising veterinarian or practice manager immediately. C. Confront the technician directly and demand they stop refilling the prescriptions. D. Take note of the behavior and wait until multiple violations occur before reporting. Answer. B. Report the issue to the supervising veterinarian or practice manager immediately. Explanation. According to D regulations and AVMA guidelines, only licensed veterinarians may authorize and dispense controlled substances. Unauthorized refills of Schedule Omni-V drugs can lead to severe legal and professional consequences for the practice. Option ignoring the issue is incorrect, as veterinary technicians have an ethical duty to ensure compliance with drug laws. Option C, confronting the technician directly, is not the best approach, as it could escalate the situation without proper resolution. Option D, waiting for more violations, is inappropriate because any unauthorized dispensing of controlled substances is a serious offense and should be addressed immediately. The best practice is to report the situation to the veterinarian or practice manager, who can take appropriate legal and ethical actions to ensure compliance. Question 4. Veterinary pharmacology and toxicology. A veterinary technician is preparing an anesthetic protocol for a geriatric canine patient undergoing a dental procedure. The patient has a history of moderate cardiac disease and mild renal insufficiency. The veterinarian has prescribed an anesthetic combination including an opioid, a benzodiazepine, and an inhalant anesthetic. Which of the following choices represents the C? Anesthetic protocol for this patient? A. Medetomidine or agonist, ketamine isoflurane. B. Morphine opioid, midazolam, benzodiazepine, sevoflurane. C. Acetpromazine, phenethazine, propofol, disflurane. D. Dexmedetomidine or agonist, thiopental, halothane. Answer: B. Morphine opioid, midazolam, benzodiazepine, sevoflurane. Explanation: Optional incorrect. Medetomidine is an agonist which causes profound vasoconstriction and bradycardia, making it unsafe for cardiac compromised patient. Option B correct. Morphine provides analgesia, midazolam is safe anxiolytic and muscle relaxant for cardiac patients, and sevoflurane is better inhalant for patients with cardiac or renal issues due to its low solubility and rapid elimination. Option C incorrect. Acetpromazine can cause significant hypotension, and propofol, though useful, can exacerbate hypotension in cardiac patient. Disflurane has higher risk of respiratory irritation. Option D incorrect. Dexmedetomidine and thiopental are unsuitable for patient with cardiac and renal issues as they can cause bradycardia, hypotension, and prolonged metabolism. Relevant guidelines. Safe anesthetic protocols for geriatric and cardiac compromised patients emphasize minimizing cardiovascular depression using balanced anesthesia and optimizing oxygenation and perfusion. Question 5. Veterinary pathology and disease processes. Scenario-based. Dr. Patel is treating a 6-year-old golden retriever, Max, who presents with lethargy, polydipsia, and persistent vomiting. Initial diagnostics reveal hypokalemia, hyponatremia, and a low cortisol response to an ACT stimulation test. The veterinarian diagnoses Max with hypodrenocorticism, Addison's disease. Which of the following is the most appropriate? Immediate treatment. Romanoids, 0.9% NaCl, dexamethasone, and fludrocortisone. B. Subcutaneous fluids, oral prednisone, and potassium chloride supplementation, a romanactated Ringer's solution, methimazole, and insulin. D. Oral fludrocortisone, dietary sodium restriction, and potassium-sparing diuretics. Answer: A. Romanoids, 0.9% NaCl, dexamethasone, and fludrocortisone. Explanation: Optional correct. Addison's disease leads to an acute adrenal crisis characterized by electrolyte imbalances. The most critical immediate treatment involves Romanoid resuscitation with 0.9% NaCl to correct hyponatremia and hypokalemia. Dexamethasone provides immediate glucocorticoid replacement without interfering with diagnostic testing, while fludrocortisone or desoxycorticosterone pivalate (DOP) serves as long-term mineralocorticoid replacement. Option B incorrect. Subcutaneous fluids are insufficient for managing Addisonian crisis. Potassium chloride is contraindicated due to the risk of worsening hypokalemia. Option C incorrect. Methimazole is for hypothyroidism and insulin is used to manage hypokalemia in some conditions but is not the first-line treatment in Addison's crisis. Option D incorrect. Dietary sodium restriction and potassium-sparing diuretics worsen Addisonian symptoms. Oral therapy is not appropriate for acute crises. Relevant guidelines. The American College of Veterinary Internal Medicine (ACVIM) recommends aggressive fluid therapy and corticosteroid administration for acute adrenal crises. Question 6. Veterinary dentistry. A technician is assisting in a dental procedure on a 4-year-old cat diagnosed with advanced feline chronic gingivitis SCGS. The veterinarian recommends full mouth extractions. Which statement best explains why extractions are the preferred treatment for SCGS? A. Removing all teeth eliminates plaque retentive surfaces, reducing inflammation and allowing the immune system to recover. B. Full mouth extractions decrease bacterial colonization, which prevents future periodontal disease. C. SCGS is caused by dietary allergies and extractions reduce food allergies by altering digestion. D. Tooth extractions stimulate immune function and regenerate lost periodontal ligament. Answer: A. Removing all teeth eliminates plaque retentive surfaces, reducing inflammation and allowing the immune system to recover. Explanation: Option is correct. SCGS is an immune-mediated condition where the body reacts excessively to plaque. Removing the teeth reduces plaque accumulation and alleviates inflammation. Option B, incorrect. While extractions reduce bacterial load, SCGS is primarily an immune-mediated disease, not just bacterial colonization. Option C, incorrect. There is no direct correlation between SCGS and food allergies. Option D, incorrect. Extraction does not stimulate immune function or regenerate periodontal ligaments. Relevant guidelines. The American Veterinary Dental College recommends full mouth extractions as the most effective treatment for severe ADs. Question 7. Veterinary emergency in critical care. A dog is brought into the clinic after being hit by a car. The patient is non-responsive, has irregular breathing, and a weak femoral pulse. The technician prepares for resuscitation. According to Recover CPR guidelines, what is the correct chest compression rate and depth for a medium-sized dog? A 80-100 compressions per minute, compressing the chest 1/3 of its width. B 100-120 compressions per minute, compressing the chest 1/2 of its width. C 40-60 compressions per minute, with shallow compressions to prevent further injury. D 150-180 compressions per minute, with deep compressions to maximize circulation. Answer B 100-120 compressions per minute, compressing the chest 1/2 of its width. Explanation. Option incorrect. The recommended compression rate is 100-120 compressions per minute, not 80-100. Option B correct. Recover CPR guidelines recommend 100-120 compressions per minute, with compressions reaching about 1-2 the chest width for optimal circulation. Option C incorrect. Slow compression rate of 40-60 is ineffective for perfusion. Option D incorrect. 150-180 compressions per minute are too fast and do not allow proper chest recoil. Relevant guidelines. The Recover Reassessment Campaign on Veterinary Resuscitation Guidelines provide standardized CPR protocols for veterinary patients. Question 8. Veterinary radiology and diagnostic imaging. A 7-year-old German Shepherd presents with chronic lameness in the hind limb. The veterinarian suspects hip dysplasia and orders radiographs. To obtain a diagnostic ventrodorsal (VD) hip extended view, which of the following positioning techniques is correct? A. The dog should be placed in dorsal recumbency with the hind limbs extended and femurs parallel to each other with slight internal rotation. B. The dog should be placed in lateral recumbency with the hind limb of interest extended and the opposite limb flexed. C. The dog should be placed in dorsal recumbency with the hind limbs flexed at a 45-degree angle to the spine. D. The dog should be placed in standing position with a horizontal directed at the hip joints. Answer A. The dog should be placed in dorsal recumbency with the hind limbs extended and femurs parallel to each other with slight internal rotation. Explanation. Options are correct. This is the correct positioning for the standard VD hip extended radiographic view commonly used for evaluating hip dysplasia. Option B incorrect. Lateral recumbency is used for lateral hip radiographs, but not for standard hip dysplasia screening. Option C incorrect. Flex positioning is used in pen hip evaluation, but not in standard OFA orthopedic foundation for animals radiographs. Option D incorrect. A standing position does not provide an accurate diagnostic image for hip dysplasia. Relevant guidelines, OFA, and pen hip protocols recommend proper positioning for accurate hip dysplasia evaluation. Question 9. Veterinary pharmacology and drug safety. A 5-year-old feline patient is diagnosed with hypertrophic cardiomyopathy (HCM). The veterinarian prescribes atenolol, a beta blocker. What is the primary mechanism of action of atenolol in managing HCM? A. Increases myocardial contractility and improves cardiac output. B. It decreases heart rate and myocardial oxygen demand by blocking beta-1 adrenergic receptors. C. It inhibits angiotensin-converting enzyme ACE to reduce blood pressure. D. It enhances calcium influx in cardiac muscle, improving contractility. Answer B. It decreases heart rate and myocardial oxygen demand by blocking beta-1 adrenergic receptors. Explanation. Option were incorrect. Atenolol does not increase contractility, it slows heart rate to reduce myocardial workload. Option B correct. Atenolol is a selective beta-1 blocker that decreases heart rate and myocardial oxygen consumption, which is beneficial in HCM. Option C incorrect. ACE inhibitors like enalapril reduce blood pressure but do not work via beta-adrenergic blockade. Option D incorrect. Calcium channel blockers, not beta blockers, enhance calcium influx. Relevant guidelines. Beta blockers are a primary treatment for HCM to reduce arrhythmias and myocardial stress. Question 10. Veterinary emergency and critical care. A dog is presented with suspected anaphylactic shock after a bee sting. The veterinarian orders immediate treatment. Which of the following interventions is the most critical first-line therapy? A. Romanoids, diphenhydramine, and corticosteroids. B. Epinephrine, oxygen therapy, and Romanoids. C. Antihistamines, atropine, and Romanoids. D. Glucocorticoids, bronchodilators, and fluid restriction. Answer: B. Epinephrine, oxygen therapy, and Romanoids. Explanation: Option quote incorrect. While diphenhydramine and steroids may help later, epinephrine is the immediate priority. Option B correct. Epinephrine is the first-line treatment for anaphylaxis. Oxygen therapy supports respiration. Romanoids counteract hypotension. Option C incorrect. Atropine is not indicated for anaphylaxis management. Option D incorrect. Fluid restriction is not appropriate. Aggressive Romanoid resuscitation is required. Relevant guidelines. Immediate administration of epinephrine is recommended for anaphylaxis in veterinary medicine. Question 11. Veterinary surgery and wound management. A horse presents with a deep laceration to the distal limb that occurred 12 hours ago. The wound is contaminated but shows no signs of infection. What is the most appropriate method of closure? A. Primary closure with sutures after thorough lavage and debridement. B. Delayed primary closure after initial wound management and observation. C. Healing by second intention with no surgical closure. D. Immediate closure with cyanoacrylate tissue adhesive. Answer: B. Delayed primary closure after initial wound management and observation. Explanation: Option was incorrect. Primary closure is ideal for fresh, clean wounds, but delayed closure is safer for contaminated wounds. Option B correct. Delayed primary closure allows for initial infection control and tissue assessment before closure. Option C incorrect. Second intention healing may be necessary for highly contaminated wounds, but is not the best choice here. Option D incorrect. Tissue adhesive is inappropriate for deep wounds. Relevant guidelines. Contaminated wounds benefit from delayed primary closure to reduce infection risk. Question 12. Veterinary parasitology. A veterinarian diagnoses a dog with heartworm disease, Dirofilaria mitis, and prescribes a treatment protocol. What is the primary function of melasomine in heartworm treatment? A. It kills adult heartworms in the pulmonary arteries. B. It eliminates microfilariae from the bloodstream. C. It prevents new infections by inhibiting mosquito transmission. D. It acts as an anti-inflammatory agent to reduce lung damage. Answer A. It kills adult heartworms in the pulmonary arteries. Explanation: Option was correct. Melasomine is an adulticide that targets mature heartworms in the pulmonary arteries. Option B incorrect. Ivermectin is used to eliminate microfilariae. Option C incorrect. Preventatives like selamectin or milbemycin prevent new infections. Option D incorrect. Corticosteroids reduce inflammation but do not treat heartworms. Relevant guidelines. The American Heartworm Society recommends melasomine as the primary treatment for adult heartworms. Question 13. Veterinary anesthesia and pain management. A 5-year-old golden retriever is scheduled for a tibial plateau leveling osteotomy TPLA. The veterinarian plans a multimodal analgesia approach for pain management. Which of the following drug combinations best provides preemptive analgesia for this procedure? A. Methadone, opioid, NSAID, and local anesthetic block. B. Cefprozil, sedative, NSAID, and dexmedetomidine, alpha-2 agonist. C. Ketamine, NADA antagonist, tramadol, and diphenhydramine. D. Propofol, lidocaine, infusion, and aspirin. Answer A. Methadone, opioid, NSAID, and local anesthetic block. Explanation: Option was all correct. This combination provides opioid analgesia, anti-inflammatory effects, and local nerve blockade, which is the most effective approach. Option B incorrect. Cefprozil provides sedation, not analgesia. Option C incorrect. Tramadol is not a first-line analgesic, and diphenhydramine is not an analgesic. Option D incorrect. Aspirin is not an ideal NSAID for surgical pain, and propofol is not an analgesic. Relevant guidelines. Multimodal analgesia involving opioids, NSAIDs, and local anesthetics is the standard of care for orthopedic procedures. Question 14. Veterinary clinical pathology. A veterinarian performs a blood smear evaluation on a lethargic cat with suspected anemia. The smear reveals regenerative anemia with Howell-Jolly bodies and Heinz bodies. Which of the following is the most likely cause? A. Onion or garlic toxicity. B. Iron deficiency anemia. C. Immune-mediated hemolytic anemia. D. Chronic kidney disease. Answer A. Onion or garlic toxicity. Explanation. Option is correct. Onion and garlic toxicity cause oxidative damage, leading to Heinz body formation and hemolytic anemia. Option B incorrect. Iron deficiency anemia is non-regenerative and does not cause Heinz bodies. Option C incorrect. IMHA causes spherocytes and agglutination rather than Heinz bodies. Option D incorrect. Chronic kidney disease typically causes non-regenerative anemia. Relevant guidelines. Heinz bodies are associated with oxidative damage, often due to toxic ingestion in cats. Question 15. Veterinary toxicology. A dog presents with severe vomiting, diarrhea, and ataxia after ingesting an unknown substance. The owner mentions having cocoa powder spilled on the kitchen floor earlier. Which compound is responsible for the toxicity? A. Theobromine. B. Xylitol. C. Aflatoxin. D. Organophosphate. Answer A. Theobromine. Explanation. Option was correct. Theobromine, found in chocolate, causes gastrointestinal and neurologic signs in dogs. Option B incorrect. Xylitol causes hypoglycemia and liver damage but does not come from cocoa powder. Option C incorrect. Aflatoxins are mold toxins affecting the liver, not related to chocolate. Option D incorrect. Organophosphates cause cholinergic toxicity but are not found in chocolate. Relevant guidelines. Theobromine is toxic to dogs with darker chocolates, posing the greatest risk. Question 16. Veterinary nutrition. A 3-year-old domestic short-haired cat is diagnosed with struvite urolithiasis. What dietary modification is recommended for management and prevention? A. Increase moisture intake and reduce urinary pH. B. Increase dietary protein and phosphorus. C. Reduce fat content and increase fiber. D. Eliminate all animal-based proteins. Answer A. Increase moisture intake and reduce urinary pH. Explanation. Option was all correct. Moisture promotes urine dilution and acidification reduces struvite crystal formation. Option B incorrect. High phosphorus can contribute to stone formation. Option C incorrect. Fat and fiber do not directly impact urinary stones. Option D incorrect. Animal proteins help maintain overall health. Relevant guidelines. Struvite dissolution diets focus on urine acidification and increased hydration. Question 17. Veterinary cardiology. A 10-year-old Dachshund is diagnosed with degenerative mitral valve disease. Which of the following is the first-line medication for management? A. Pimobendan. B. Atenolol. C. Lidocaine. D. Diltiazem. Correct answer A. Pimobendan. Explanation. Optional correct. Pimobendan is a positive inotropin vasodilator, improving cardiac function. Option B incorrect. Atenolol is used for arrhythmias, not valve disease. Option C incorrect. Lidocaine is for acute ventricular arrhythmias. Option D incorrect. Diltiazem is for supraventricular tachycardia, not mitral valve disease. Relevant guidelines. Pimobendan is recommended for congestive heart failure due to mitral valve disease. Question 18. Veterinary dermatology. A dog presents with chronic pruritus-erythema and alopecia. Cytology reveals malassezia overgrowth. What is the most appropriate treatment? A. Ketoconazole or miconazole therapy. B. Systemic corticosteroids alone. C. Antibiotics for secondary bacterial infection only. D. Dietary changes and antihistamines. Answer A. Ketoconazole or miconazole therapy. Explanation. Optionals were correct. Antifungal therapy is needed for malassezia overgrowth. Option B incorrect. Corticosteroids can worsen fungal infections. Option C incorrect. Bacterial infections may be secondary but do not treat malassezia. Option D incorrect. Diet may help underlying allergies but does not resolve malassezia. Relevant guidelines. Topical or systemic antifungal therapy is the treatment of choice. Question 19. Veterinary ophthalmology. A cat presents with a cloudy, painful eye. Fluorescein stain reveals a dendritic ulcer. What is the most likely cause? A. Feline herpes virus FHE1. B. Glaucoma. C. Bacterial conjunctivitis. D. Lens luxation. Answer A. Feline herpes virus FH1. Explanation. Options are correct. FH1 commonly causes dendritic corneal ulcers in cats. Option B incorrect. Glaucoma causes increased intraocular pressure, not ulcers. Option C, incorrect. Bacterial conjunctivitis causes discharge but not dendritic ulcers. Option D, incorrect. Lens luxation affects lens position, not corneal health. Relevant guidelines. Antiviral therapy is required for herpes virus-related ulcers. Question 20. Veterinary zoonoses and public health. A client presents a pet ferret with respiratory signs and reports having the flu. What is the primary concern regarding zoonotic transmission? A. Influenza virus transmission from human to ferret. B. Rabies virus transmission. C. Leptospirosis risk. D. Brucellosis transmission. Answer A. Influenza virus transmission from human to ferret. Explanation. Option was all correct. Ferrets are highly susceptible to human influenza viruses. Option B, incorrect. Rabies is rare in pet ferrets. Option C, incorrect. Leptospirosis is more common in dogs and livestock. Option D, incorrect. Brucellosis is not a concern in ferrets. Relevant guidelines. Infected humans should limit contact with ferrets during illness. Question 21. Veterinary pharmacology. A 3-year-old Labrador retriever with epilepsy has been receiving phenobarbital for seizure control. During a routine blood test, the veterinarian notes elevated liver enzyme levels. What is the most appropriate next step in management? A. Continue phenobarbital and monitor liver enzymes regularly. B. Discontinue phenobarbital immediately and switch to potassium bromide. C. Reduce the dose of phenobarbital and add hepatoprotective agents. D. Increase the dose of phenobarbital to compensate for hepatic metabolism. Answer. C. Reduce the dose of phenobarbital and add hepatoprotective agents. Explanation. Option C, correct. Phenobarbital is metabolized by the liver and can cause enzyme elevation and hepatotoxicity. Reducing the dose and adding hepatoprotectants E. G. Say milk thistle can help. Option was incorrect. Continued use without dose adjustment may worsen liver damage. Option B, incorrect. Sudden discontinuation may trigger withdrawal seizures. Option D, incorrect. Increasing the dose would further strain the liver. Relevant guidelines. Liver enzyme monitoring is essential in long-term phenobarbital therapy. Question 22. Veterinary parasitology. A farmer reports that several cows in his herd are experiencing severe pruritus and hair loss, especially around the neck and shoulders. Microscopic examination of skin scrapings reveals sarcoptic mites. What is the most effective treatment? A. Ivermectin or doramectin injection. B. Topical antifungal therapy. C. Oral corticosteroids for inflammation. D. Tetracycline antibiotics. Answer A. Ivermectin or doramectin injection. Explanation. Option was all correct. Sarcoptic manging cattle is best treated with macrocyclic lactones like ivermectin. Option B, incorrect. Fungal therapy is ineffective against mites. Option C, incorrect. Corticosteroids may suppress immune function and worsen infestation. Option D, incorrect. Tetracyclines are used for bacterial infections, not mange. Relevant guidelines. Quarantine and treating the entire herd prevent reinfestation. Question 23. Veterinary reproduction. A breeder brings in a 4-year-old mare that has not been able to conceive despite multiple matings. A reproductive exam reveals an enlarged uterus with fluid accumulation. What is the most likely diagnosis? A. Endometritis. B. Ovarian cysts. C. Pyometra. D. Uterine torsion. Answer A. Endometritis. Explanation. Optional correct. Endometritis is a common cause of infertility in mares due to bacterial or fungal infections. Option B, incorrect. Ovarian cysts affect ovulation but do not cause uterine fluid accumulation. Option C, incorrect. Pyometra is rare in mares due to their cervix remaining open. Option D, incorrect. Uterine torsion presents with colic, not infertility. Relevant guidelines. Endometrial culture and biopsy help diagnose and guide treatment. Question 24. Veterinary orthopedics. A 6-month-old German Shepherd presents with lameness and pain in both front legs. Radiograph revealed bilateral retained cartilage cause in the distal ulna. What is the best treatment option? A. Surgical intervention to correct the growth deformity. B. NSAIDs in cage rest for 2 weeks. C. Calcium and phosphorus supplementation. D. Physical therapy and exercise restriction. Answer A. Surgical intervention to correct the growth deformity. Explanation. Option was all correct. Retained cartilage cause can lead to limb deformities, requiring surgical correction. Option B, incorrect. Conservative management is often ineffective. Option C, incorrect. Excess calcium can worsen cartilage abnormalities. Option D, incorrect. While exercise restriction can help, surgery is often needed. Relevant guidelines. Early intervention prevents permanent deformities. Question 25. Veterinary emergency medicine. A dog is brought in after ingesting an unknown quantity of ibuprofen. What is the primary concern with this toxicity? A. Gastrointestinal ulceration and renal failure. B. Seizures and hyperactivity. C. Severe hypoglycemia and liver failure. D. Acute cardiac arrhythmias. Answer A. Gastrointestinal ulceration and renal failure. Explanation. Bopsh's rules were correct. NSAID toxicity causes key ulcers and renal damage in dogs. Option B, incorrect. Neurologic signs are not the primary concern. Option C, incorrect. Ibuprofen does not cause hypoglycemia. Option D, incorrect. NSAIDs do not directly cause arrhythmias. Relevant guidelines. Activated charcoal and romanide are critical in early treatment. Question 26. Veterinary surgery. A veterinarian is performing a spay on a dog and accidentally lacerates the splenic artery. What is the most immediate course of action? A. Clamp the artery and ligate it immediately. B. Flush the abdominal cavity with sterile saline. C. Apply direct pressure and monitor for clot formation. D. Complete the spay before addressing the bleeding. Answer A. Clamp the artery and ligate it immediately. Explanation. Option is correct. Rapid hemostasis is essential to prevent hemorrhagic shock. Option B, incorrect. Flushing does not stop active bleeding. Option C, incorrect. Direct pressure is a temporary measure, not a solution. Option D, incorrect. Bleeding must be controlled immediately before continuing. Relevant guidelines. Proper surgical technique reduces the risk of vascular injury. Question 27. Veterinary epidemiology. An outbreak of canine parvovirus occurs at a shelter. Which of the following measures is most effective in preventing further spread? A. Strict isolation and disinfection of contaminated areas. B. Administering antibiotics to all dogs. C. Euthanizing all affected animals. D. Encouraging natural immunity through exposure. Answer A. Strict isolation and disinfection of contaminated areas. Explanation. Option is correct. Parvovirus is highly contagious and requires strict biosecurity measures. Option B, incorrect. Antibiotics do not treat viral infections. Option C, incorrect. Euthanasia is unnecessary with proper care. Option D, incorrect. Exposure increases mortality. Relevant guidelines. Vaccination and sanitation are key to parvovirus control. Question 20. Veterinary endocrinology. A cat presents with weight loss, polyphagia, and hyperactivity. Blood tests show elevated T levels. What is the most appropriate long-term treatment? A. Methimazole or radioactive iodine therapy. B. High-protein diet and corticosteroids. C. Beta blockers to manage hyperactivity. D. Insulin therapy. Answer A. Methimazole or radioactive iodine therapy. Explanation. Option is correct. Hyperthyroidism is treated with antithyroid drugs or iodine therapy. Option B, incorrect. Corticosteroids are not used for hyperthyroidism. Option C, incorrect. Beta blockers help control symptoms but do not treat the disease. Option D, incorrect. Insulin is for diabetes, not hyperthyroidism. Relevant guidelines. Radioactive iodine is the gold standard for long-term control. Question 29. Veterinary cardiology. A 10-year-old Cavalier King Charles Spaniel is brought in for a routine checkup. The owner reports occasional coughing and exercise intolerance. On auscultation, you detect a systolic murmur at the left apex. What is the most likely diagnosis and what is the recommended treatment? A. Mitral valve disease. A treat with pimobendan, ACE inhibitors, and diuretics if heart failure develops. B. Dilated cardiomyopathy. A treat with taurine and L-carnitine supplements. C. Pulmonic stenosis. Recommend balloon valvuloplasty. D. Heartworm disease. A start immediate adulticide therapy. Answer A. Mitral valve disease. Treat with pimobendan, ACE inhibitors, and diuretics if heart failure develops. Explanation. Option is correct. Mitral valve disease, MVD, is common in older small breed dogs. It leads to heart failure managed with pimobendan, positive inotrope, ACE inhibitors, reduce afterload, and diuretics control pulmonary congestion. Option B, incorrect. Dilated cardiomyopathy, DCM, is more common in large breeds and requires different treatment. Option C, incorrect. Pulmonic stenosis is congenital and more common in young dogs. Option D incorrect. Heartworm disease presents with more severe respiratory signs and right-sided heart failure. Relevant guidelines. Regular echocardiography helps monitor disease progression. Question 30. Veterinary toxicology. A 5-year-old golden retriever is brought to the clinic after ingesting a large amount of dark chocolate. The owner reports restlessness and vomiting. Upon examination, the dog has tachycardia and mild tremors. What is the most appropriate initial treatment? A. Induce emesis, administer activated charcoal and provide Roman uids with ECG monitoring. B. Administer atropine to counteract bradycardia. C. Give insulin to stabilize blood glucose levels. D. Perform an immediate gastric lavage under anesthesia. Answer A. Induce emesis, administer activated charcoal, and provide Roman uids with ECG monitoring. Explanation. Option was all correct. Theobromine in chocolate cause CNS stimulation, tachycardia, and arrhythmias. Emesis, if recent ingestion, activated charcoal to prevent further absorption, Roman uids to promote excretion, and ECG monitoring are standard treatments. Option B incorrect. The dog is tachycardic, not bradycardic, so atropine is contraindicated. Option C incorrect. Chocolate toxicity does not cause hypoglycemia requiring insulin. Option D incorrect. Gastric lavage is usually unnecessary if emesis is effective. Relevant guidelines. Theobromine toxicity is dose dependent, with dark chocolate being more toxic than milk chocolate.